Well, code red on Tuesday morning, and an alarming new study out today that shows ramping times were blowing out in Victoria years before COVID. And that increases, of course, a patient's chance of dying if they can't get to hospital. Now, ramping's when paramedics are forced to keep caring for patients inside an ambulance but parked outside a hospital due to bed shortages in emergency. And this particular study out today shows that during similar code red periods back in 2018, 70 deaths could have been prevented. So you can only imagine the consequences of the current crisis. 5 code reds in this year alone. Joining me now is the Victorian Shadow Minister for Health, Georgie Crozier. The government's tried all week, Georgie, to say that this is only happening because of COVID, but this report proves that that's just a cover-up.
Peter, that's exactly right. The Premier is just wrong because this report that's been conducted by the Medical Journal of Australia does show that there may have been 70 lives lost due to ramping prior to COVID. So this was happening prior to COVID, the ramping situation, and tragically, as we know, far too many Victorians have lost their lives in recent months because of failures to get through to 000 or not being able to get to an ambulance. But this report is damning, and it just demonstrates that Daniel Andrews and his comments are just plain wrong on this.
This report deals with the issue of ramping, which we've just discussed. That's when you're stuck outside the hospital, you can't get into emergency, and we're talking about lives lost. But we've also got the instance where people can't even get out of their homes. They call an ambulance, they can't get one, or they can't get through. They're not even in the ambulance that's ramped. So this is a much bigger crisis than perhaps the reports are telling us. But of course, when the government's pushed on this issue, they just say, stop calling 000 if you don't need to, but that's not the issue.
No, the government's blaming Victorians over this crisis. I mean, this is just years of mismanagement and lack of planning, as we know. COVID, of course, has exacerbated issues, but when you can't get an ambulance, when there are code reds called, and when the public don't even know that there is a code red, this is an incredibly dangerous situation. So calling an ambulance and none are available, this can be the difference between a life saved and a life lost. And this is what we're finding that's happened here in Victoria, where it hasn't happened in other states. They haven't had the 21 lives because an ambulance wasn't available or couldn't get through to 000. These failings are monumental in Victoria, and it's the Andrews government that has been in power for the last 8 years. They are responsible for this mess, no one else. They can't blame the federal government. They can't blame anyone else. They continue to do that, but I think they've been shown up once again. It's been exposed yet again for the true situation about what's been going on. And I say again, Peter, it's been years in the making. It's a lack of planning and preparation.
Yeah, and I do think it's extraordinary that we're now not being told about these code reds. We're finding out about them, but they're not being announced as they should be transparently. I have to leave it there, Georgie. Thanks for your attention on this issue. Keep up the fight.